Okay, it's 6 p.m. I'd like to call this meeting of the Tarrant County Emergency Services District Number 1 to order. We're going to start this the session with an invocation by Pastor Eric Auger.
Thank you for inviting me here today. Thank you so much. Father, thank you for the opportunity to gather together on this first month of the year. Lord, we can recollect what we all went through this last year, and Lord, how you've used everyone in this very room to serve these communities of Tarrant County here, District 1. Lord, we pray, Father, first of all, for the safety of our firefighters, our EMS, those that serve us within our communities. Lord, thank you that the skills that you've given them to combat all the different things that you do, that you present to them. Lord, we are the benefactors as the citizens of this community, and we're so grateful, Father, for them. Father, for these leaders that are here tonight, the Lord, for this board, that you would lead them and guide them, and that, Lord, for any new recruits that are coming on, that, Lord, you would bless them and give them and provide them the skill. But, Father, you know what comes this year of 2026. Father, you know it before we know it. So, Lord, I pray that you would use every skill to serve you as best as we can in everything that we do, whether it's in healthcare or in the EMS services of the firefighters. Bless this meeting and protect them tonight. We pray all this in the mighty name of Jesus. Amen.
Amen. Amen.
Thank you.
We'll now do the pledge of allegiance to the United States and Texas flag. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Okay, item 4, presentations. The December 2025 financial report.
Thank you, Mr. President. I am happy to report that after last month's meeting and the approvals for the software purchases that were discussed, staff has moved forward with getting both a payroll and an ERP system up and running. That's going to be a rather lengthy process, but that has started. The meetings with those software firms are ongoing on a weekly basis. Both Alicia and Jen have been really busy with those, sometimes 2 meetings a day in some instances, depending on, in addition to all their other duties. So we're happy to report that that's going on. I am also excited to report to you that we have been able to pretty much close out the ARPA reimbursements over the last month. We were able to get all that paperwork in from the departments. The payments to the departments have been made from the ESD to each department, and our paperwork has been submitted to the county for our reimbursements. There were a few discrepancies within some of the paperwork that we received that staff has been working with staff in the departments to get those corrected, different things, mostly just clarity of receipts. Some of them were blurry, things like that. So we're working through all that, and for the most part, that's all back at the county now, so we're just waiting on those reimbursements to come back to us.
Chief,
yes.
What is the normal time frame on getting that reimbursement? Does Tarrant County give us any indication on that?
They'd have not, and frankly, Elizabeth was handling all that right when I first started, and I've not dealt directly with one of those. Jennifer, did they give you any indication on a time frame?
They did not, but once everything is complete, then she said she would give me an update.
Okay. Perfect. Thank you.
Yes, sir. You can see here the list of expenses through the month between fleet, personnel costs, reimbursements through payments out to the fire departments. And then on down again to, we had the big land payment for the property in Rendon, and then also the ARPA payments going out, which will be fully reimbursed back to the district. So about $9 million going out since we last met. So a lot going on. And our tax pool fund balance is there at the bottom, roughly $17 million in the bank as we sit today.
Okay, item 5 is Board of Commissioners comments and announcements. Do any commissioners have a comment or an announcement?
Happy 2026.
Yeah, welcome to 2026.
Okay, nothing else. We'll move into the consent agenda. I'll accept a motion to approve the consent agenda.
So moved. Seconded.
All in favor?
Aye.
The consent agenda is approved as submitted. Item 9 is public hearings, meetings, and other related items. I understand we have none. So we'll move on to item 10, contracts, agreements, bid awards, and other related items. Item A is discussion and/or action on the lease purchase of mobile data computers for computer-aided dispatch interface and electronic patient care reporting, and authorize the board president to execute the purchase agreement.
Thank you, Mr. President. As you are likely aware, it's very commonplace to carry mobile data computers in fire trucks and ambulances in 2026 for both CAD interface and for our personnel to complete patient reports when we run EMS calls in the field. There are currently no MDCs or patient care laptops in service for the ESD itself. This plan, as presented, will provide MDCs in all of our frontline fire trucks and ambulances. We built the plan towards all 4 stations that will go in service in 2026. So that's a total of 8 frontline apparatus that would have those in them. And then a patient care laptop also for each of those vehicles. And then we are maintaining a reserve of 1 of each, so that if one goes down, has to go off to the shop, we have one that we can give that crew to use. And our recommendation, because technology is always evolving and changing, is to do this through a 5-year lease purchase. And basically it will just become a 5-year process that we will turn around and come back to you in 5 years, and we'll renew that lease purchase. We'll get new equipment to go on the trucks as the technology continues to evolve, and just continue in that process. But as it's presented, Jeff did a lion's share of the work on all of this, did a great job. He met with representatives from the 3 big companies that are in the mobile ruggedized market, with Dell and GTAC and Panasonic. All of them are on cooperative purchasing agreements. Pricing is fairly comparable. An extra feature here or there may make it a little more or a little less. When it was all said and done, we felt strongly that the GTAC products were the better way to go for us. They had less moving parts, if you will, that we have to worry about breaking and having fixed. Familiarity with the staff and history of usage among the staff and other agencies in the past. GTAC has a good record of all in all those areas. So our proposal to you tonight with that is to move forward with GTS Technology Solutions, who is the vendor for GTAC ruggedized computers, to provide this through the TIPS Cooperative Purchasing Agreement on a 5-year lease purchase. And if you refer to your briefings, that annual payment is just under $30,000 a year. There'll be some installation costs and so forth that'll be associated with getting the hardware put in the trucks initially. That's not part of the lease. We'll pay that outside of the lease, but the annual lease is $29,000 and change for the next 5 years. So
Chief, is the 5-year kind of replenishment, is that kind of the standard best practice in the industry?
Yes, sir. Yes, it is. And 5 years is a pretty average turnover on computers, even for turnovers in the, for computers in the office and so forth, your internal laptops and what have you. That's just pretty standard practice, because it does evolve so much And you've all experienced that probably with your own personal laptops and home PCs, so, yes, ma'am.
And thank you. And also too, in that 5-year lease, does that include any updates or anything? Because that, it happens, you know, updates
Sure.
are coming.
Sure.
So do we have to pay extra for any of that, or does it include all of that?
It's all included.
Okay, great, thank you.
And it's like repairs, it's supposed to be one of those deals where we take it down, we ship it off, overnight it to them, they get it fixed back to us as quick as they can. And like I said, we're overbuying by one of each so that we have a spare in-house that we can run out to a crew in the event their computer goes down, because inevitably that's going to happen.
We're buying 9 of these, so it's roughly a little more than 3,000.
9 of each.
Okay,
so
so
it-
18.
It's 18. Now, is that accurate, Jeff? Am I messing that up?
Actually, it'll be 10 and 9.
10 and 9.
Okay.
Okay.
Are there
Yeah, the
supply
battalion
chain,
chief's truck will have one in it as well. That's where the 10th one comes in.
okay. Are there supply chain issues? I mean, a fire truck takes 3 years. I mean, are we gonna have this issue with fire-related equipment like this?
That I don't know. They were not able to, that was one of the questions I asked of all 3 of them. GTAC was the one out of the 3 that gave me the most promising answer of, as soon as we get your order, we will start processing and shipping, so.
Yeah. It doesn't sound like 36 months. I think we'll be better off than that, I hope. But
Yeah, I hope.
you just never know.
Well, I mean, if there's delay issues, we might want to consider, because I'm sure we're gonna be adding more of these in the near future. Going ahead and getting them.
As we order those additional stations. I think after we get past the strategic plan, the financial forecast, and kind of what the board's direction is over the next couple of meetings with how we want to move forward with building fire stations and all of that, that's going to have a direct impact on the implementation of additional stations and these needed additional pieces of equipment. I think we just adjust according to what the board decides, but you're correct. We'll certainly keep that in the forefront.
Okay,
And then also my last question and comment is there any training that is involved in this as far as the,
Yes. Yeah. Getting them up to speed on using it all. Chief Ballou will handle a lot of the in-house training with the crews as far as the CAD interface goes and so
Right.
forth. But most of the folks on our team are familiar with mobile
with
data
it.
computers and the EPCR laptops. It's very commonplace in the industry.
okay, thank you.
Yes, ma'am.
any other questions or comments from commissioners? Okay, then I will accept a motion to approve the lease purchase of mobile data computers for computer-aided dispatch interface and electronic patient care reporting, and authorize the board president to execute the purchase agreement.
So moved.
Do I have a second?
I second.
All in favor?
Aye.
That item passes. Item B, discussion and/or action on an agreement with EMS MC for the provision of emergency medical services billing and fire response billing services, and authorize the board president to execute the agreement. Chief Shelley?
Thank you, Mr. President. As we begin moving into ambulance transport operations in the very near future, it's going to be critical for us to have a partner in place that's going to handle our EMS billing. Past experience tells us to go ahead and participate in fire response billing as well. There's no cost to us to participate in that, and the company gets they get a percentage of what we collect on both the fire response and the ambulance billing side of things. Chief Brown and Chief Florence spent a considerable amount of time meeting with different vendors that operate in this market, and they have those on a chart for you, but it's important, especially in today's world, for them to have a strong customer service presence, a very robust website, good follow-up on making sure they have all the insurance information and what have you. And the companies that we met with are all very prominent again in the market for EMS billing, Emergicon and EMS MC being 2 of the larger companies in the United States doing this kind of work. staff has experience with several of them. Some of the other chiefs in the room have experience with those same vendors. But when it was all said and done, we ended up with responses from 3 of those vendors and 1 that chose to no bid because they didn't feel like they had enough data to provide an accurate bid. I will tell you that those that really wanted our business went and did the research behind the scenes to find the data to be able to give us those good bids. But at the end of the day, EMSMC is the second lowest on their percentage fee they will charge us, but they far surpassed in all other categories the other vendors that met with us or put in to be part of this. And it is our very strong recommendation that we move forward with EMSMC as our billing service. Another key feature that I think is important to reiterate to you all is with us getting our ambulance provider license in place and then all of the subsequent certifications and agreements that have to be signed with groups like Medicare and Medicaid and private insurance and so forth. EMSMC will help us with obtaining all of those credentials that are required to get that done. And that's just a force multiplier in making this happen even faster for us. So again, I think a valuable service they're offering. Yes, ma'am.
I'm sorry. When you say EMSMC far surpassed the others, can you elaborate a little bit on that, please?
I'll defer to Chief Brown. Let him give you all the details.
So you see column on the left is how I compared them. When we looked at all 4 of them, the 2 companies that were the best to compare against was
Chief Brown?
Yeah.
Is the mic on?
I just wasn't talking into it.
Okay.
So as you can see, the Emergicon and EMSMC were the 2 that offered the best service for us. Digitech Quick Med Claims is another one that they're a large company, but I spoke with him, I emailed with him. He just said, I don't have the data to give you anything that I think would be a fair bid to you. And I said, okay, fair enough. So EMSMC, they meet all of the criteria. And so when you look at what they offer, so the very bottom column is their collection fees. So what that means on what they collect on a net basis, they will pay themselves 4.4%. Emergicon's collection is 8%. So EMSMC is almost half the cost of Emergicon. They're both large companies that's been doing this for a number of years and have great references. And you know, I've worked with both of the companies, so I know them both pretty well. So one of the things they use is something called estimated cash per transport rate. So they look at the type of pairs that we have in our area, and they run comparisons based off of what that is. So they both gave us an idea on what each transport that we may or should be able to collect. So if you look at Emergicons, they're saying, and it's a guesstimate, all of them, it's a guesstimate. They're saying that they should be able to collect $542 per call. EMSMC, their quote came in a bit higher, so it's, you know, theirs is another $140 per call, per transport call. So with all of that said, there's a lot more value in what we expect to collect. More would be with EMSMC.
And Chief, why is there a disparity between those 2 companies on the estimated cash per transport rate? That's not a standardized thing?
Well, that's probably it.
I will tell you, all of their presentations said proprietary on the bottom when they met with us, so they have their own formulas for how they calculate that.
And it's how they calculate. So, you know, we will gather patient data. We try and gather insurance data. We get social securities. We get driver's license number and all that stuff. Well, they have resources that they're able to go in and track, basically track that person down and find out how they're insured and what they can collect. So what the costs are, their initial billing will all be similar. You know, the cost for a particular type of call will be very, very similar. But EMSMC, based off their history, feels like they are able to collect at a higher percentage, not a higher rate, but a higher percentage than what the competitors are making those assumptions on what they'll be able to collect.
And is it, I'm sorry, Richard, go ahead.
No, go ahead. Is this a locked-in contract?
It is a contract that we can use and evaluate, and we're able to get out of the contracts within 60 to 90 days. If they don't like us and we don't like them, in 60 to 90 days we can get out of the contract.
Yeah.
So so what's going to happen for us? We're going to use this company to do our collections for a couple of years, and after that time frame, we'll be able to evaluate just how well they're doing for us, right? And if they're not collecting at the market rate that we feel that we should be getting, there again we can go back out and get with some of the other companies and do another evaluation, and we're able to make those changes if we see fit to do that. So.
I think one of the big selling features for me was the really, really robust quality of EMSMC's website and the data analytics that they're offering, real-time, day-to-day, and the quality of the reports that staff is going to be able to pull off that website to report back to you all every month was absolutely impressive. That was a big discussion at lunch after that 3-hour meeting that day, was just how impressive their website was and the data that they were gathering. I mean, we can drill down to each station's district, how our collections are working. I mean, it was impressive exactly what we can get out of their data collection. And I think it will help us be more successful in collecting a higher percentage of our ambulance billing. And it's also going to help us identify areas where we may need to do some additional things to help serve the community.
And this is more cost effective than having someone on staff that is specifically designated for that.
Goodness,
Yes.
yes.
Oh, yeah.
Without a doubt.
Yes.
They have the experience and knowledge of dealing with Medicare, Medicaid, governmental contracts, changes in laws. That's what they do, and that's all they do. Their database and the experience of their personnel are incredible.
Yeah, it's going to be huge.
Okay, any other comments or questions from commissioners?
Good.
Okay, then I will accept a motion to approve an agreement with EMSMC for the provision of emergency medical services billing and fire response billing services, and authorize the board president to execute the agreement.
So moved.
Do I have a second?
Second.
All in favor?
Aye.
Aye.
Okay, I just realized, ladies, that I skipped the public comments. Has anybody signed
There
up
were
to speak?
none.
Okay. Then I will move on to item 9. There was no action items, or item 11. Item 12, briefing items. Item A is a Whiskey Flats temporary fire station grand opening and push-in ceremony update.
I will defer to Ms. Johnson to walk us through this. She's given you a kind of a tentative schedule here of the morning's festivities and what we're kind of looking at.
We're in the very beginning. Wow. We're in the very beginning stages of planning. Mr. President, if you were wanting to make a speech that morning, Chief, that'll be at 10:30, along with, what is it? coupling ceremony. It's not a ribbon
Hose
cutting.
and coupling, yeah.
It's,
Looking forward to it.
and
That's
then,
right.
yeah, and then we're doing a push-in ceremony.
So we all get in back of the fire engine, just push it? Okay.
Front of it,
In the
push
front?
it
After
into
you
the
wash
station.
it,
Okay,
you have to wash it first.
okay, all right.
This is my first
Do I
one,
gotta
so
do
I'm
any
not
kind of
entirely
exercise
sure.
to get ready for it?
We'll have some stretching prior
Okay,
to it.
thank
Make sure you're ready to go.
Because we don't want no lost time injury.
That's right. That's right.
Thank you for that. We've ordered some new merchandise to give away. We'll have this big giant firehouse bounce house for the kids, and it's my understanding there's food in the works.
There is, with some of the community members.
Okay, very good.
Okay. Chief's gonna get me in touch with them so I can get some feedback on that, so I know what we need to provide.
Okay.
But providing the weather's good, it'll be fun.
Yep, exciting stuff. Any questions on any of that?
Have we reached out to county commissioners to see if we can get one of them?
We have not. Oh, and Chief did mention color guard, so we're gonna arrange for that, but we can do that. The invitations will go to the commissioners. We just got them in this week, but they'll go out by the end of the week. If there are particular individuals that you would like invited, if you want to shoot me an email, and we'll make sure that we get invitations sent to them.
Yeah.
This is Commissioner Simmons' area?
I believe that's correct. Is that?
It's interesting because I'm District 1, supposed to be, but when I look at my neighborhood, all the trucks are District 2. Now, there's been a change. So I'm not really sure what's what.
So it'd be Commissioner Simmons or Commissioner Miles?
It would be Commissioner Miles.
Okay. So we'll need to reach out
Well,
to his
and
office
also
as
the
well.
judge.
Sure. Yeah, we'll make sure that all the commissioners and the judge are invited, but if there are any specific other dignitaries that you want to have invited, please just let us know and we'll shoot invitations to everyone. But this is the invitation the staff put together, and this is what'll be going out this week.
It looks great.
Yes. Looks fabulous.
Thank you.
All right.
Okay, item B, strategic plan and financial forecast update.
As you'll all recall, several months back, you had made the request of me to come forward at some point in the near future with the financial plan forecast for the district. I believe I made mention then that I wanted to pair that with a short-range strategic plan for us as far as fire stations, staffing, equipment replacement, training, how we're going to operate the ESD more long-term. So I have begun work on this a couple months back, continuing to work on it. I was sharing with Commissioner Caceres a few minutes ago that I've made some progress with gathering tables and putting together replacement schedules for equipment and so forth. So I have begun work on the narrative part of that. When it's finished, you'll have an actual document that you can meet with your commissioners on. I'll be happy to go do that with you if you prefer. That it can be presented at Commissioners Court, whatever we decide you want to do. But the big deal for me is just to know what those key areas are that we'll focus on in the plan, the background of the organization, how we got to where we are today, financial strategy considerations, and what we believe budget forecasting over the next 5 years is going to look like with the changes and the additions that are going to be necessary. Deployment of our facilities and timelines for that, staffing plan, fire apparatus and ambulance replacement, and then the last two, staff development and training, and then again, any strategic plan has got to have succession planning in it. Certainly not calling Chief Brown and Chief Mays and I old, but we do have expiration dates. We aren't going to be here forever. And we want to make sure that we're working hard with our internal staff and we're developing them and we're improving them and helping them, should they aspire to those higher leadership roles in the future, that we're helping get them ready to serve in that capacity for you all and for future boards. So excited to put that together. As you well know, it's a ton of work, but it is in process.
A couple of comments on
Yes,
that.
sir.
As you really talked about going into the fiscal year 2027 budget
Yep.
process, I would like to get on our radar maybe some budget workshops.
Yep.
Since we're really looking at building just a strategic plan.
Yep,
We have a lot on our plate.
we do.
And so I would like to have a couple of, at least more opportunity to help develop the next year's budget and
Yes,
kind
sir.
of have a workshop
You bet.
and I don't know if that's something that
Well-
the commissioners would like to do.
My comment was gonna tie in directly to yours. Is presentation of your narrative and the strategic plan and the financial plan, is that something that's appropriate for this meeting next month? Or is this something we need to call a special meeting?
So I'd like to give you the preliminary at the very least. My goal is next month's meeting. From that, if we want to have more of a workshop to discuss it even further, we can. I have told staff that my plan is to start the very, very initial budget process with them in March to get our framework in place, establish what our goals for next year are based on the strategic plan, and then to begin meeting with the board starting in April and having items on our agenda. Now, whether we just include a time for a workshop within the existing board meeting, we can certainly do that, or we could do it as an additional meeting separate from as a budget meeting if you prefer. But the plan would be hopefully through April and May to do those budget workshops with you all, and then staff will push on in June with finalizing what our budget is, and then the certified tax roll will come out towards the end of July. We start finalizing things, making adjustments, and then before we know it, it's August and September, and it's time to start approving budget and tax rate again. It's kind of the plan we're looking at, but the plan is absolutely in the spring to
Okay.
involve the board in some budget workshops to make sure that we're hearing all your feedback and including that in the budget as well.
Good, thank you.
You got it.
Any other comments from questions from commissioners? Okay, we're ready to move on to item C, which is a fire operations update.
And Chief Mays is out of town. He's at Disney at a wedding for his brother-in-law, so he is not here tonight to cover this with you, so I will run through things. So as of today, your Whiskey Flat station has been operational for a month. The guys down there are doing a great job. Proud of our progress there. Our Fire and EMS Records Management Program, Chief Ballou has been working diligently with that firm to get the incident reporting part of the software up and running as quickly as possible so that our personnel are using our software to track all their responses. And that part of the program is pretty well operational now. We're doing some testing on it to make sure the glitches will be minimal. And the plan is to go live with that on February 1st, and both of our stations will start using that for all of their reporting. We're ongoing on a weekly basis with Lexapol, working on our standard operating procedures and our employee policy manual. Renovations at the Briar Station are ongoing. There have been some pictures, I believe, circulated of the building now that it's been painted and the signage has been added. It's really looking good. The big ticket item out there we're working on is getting all of the bureaucratic approvals that are necessary so we can get the septic system updated. That has been a real challenge. We had to have the property resurveyed in order to get that done, so we're working through that now. We have closed on the Rendon property and accepted the repairs and the improvements that were required prior to us finishing that purchase, and we have the keys to the building. So happy to report that. Steel and Freeman is working on quotes to get the asphalt removed and replaced with concrete, that being step one for us, so that the heavy fire apparatus coming in and out, we don't have to worry about a failure with that early on. So I'm hoping very shortly in the next few weeks that we're moving forward with that going. They are moving through the mechanical, electrical, and plumbing plans so we can get those in for third-party review, and that construction will start just as quickly as we can get authorization to do so. The Whiskey Flats land has been closed on last week. That's in hand. We got the hard copies of the survey back today. Uniforms, always a challenge nowadays, getting folks into their fire department uniforms. We're about 99% done with that at this point. Everybody's got jackets and pants and shirts and all the things, which is good. And our staff picked up the new water tender for Briar last week, and that is parked in the station. And as soon as they send us a bill so we can pay for it, we will get that thing put in service. But that's your fire operations update for now. And my plan is that Chief Mays and Chief Brown will be part of these EMS and fire updates each month for you. We'll try to make them a little more exciting in the future, add some pictures and all for you as well.
I look forward to the opportunity to heckle Chief Mays.
As do I, every day, sir.
The tender 370 for Briar. I asked this question offline, but I want to get it on record. There will be a push-in ceremony for that as well?
Yes, sir. We want to get the renovations at the fire station finished so that everybody can see that, but we can do it very similar to what we're doing in Whiskey Flats with a full-on open house, and everybody can see the fire station and all that's been done as well. So, yes. Short answer is yes.
Excellent. Okay, we're ready for item D, which is an EMS operations update. Is that
Chief Brown, you want to run through these?
You can go ahead. If Chief Mays doesn't have to do it, he doesn't have to do it.
I guess so. I'm getting the fare card tonight. So our ambulance license, provider license paperwork has all been submitted to the state. They're working through that. Chief Florence and Chief Brown are working directly with our regional rep at the state on that. The preliminary indications that the state gave back to us is that they hope to have our license in our hand by the end of next month. So cautiously optimistic that we'll hit that benchmark, but that is a critical piece that has to be in place for us to continue moving forward to be able to initiate ambulance transport. So working diligently on that. All personnel, our medical directors have authorized all of our personnel after medical training.
Is Chief Florence okay?
That's what I was fixing to comment on. So I did not realize that Chief Florence was as willing of a training mannequin as he is, but he served as an IV mannequin for many of our EMS staff to check off their IV therapy skills. He's a better man than me because I'm not doing it.
He has a new nickname, Pincushion.
Yes. He said something about his 1 mile run times going down by 3 or 4 minutes as well because he's more aerodynamic now. So
Does he whistle in the wind?
probably. EMS equipment continues to come in. We're getting new items in on a weekly basis that are going in service. Continuing education program at both stations with our medical director that is also ongoing, has been going well. Ryan and James have been testing some AV items just yesterday and today that are going to enable us to be able to host continuing education in one location and broadcast it at all of our stations. And then the medical director that's teaching that will be able to move station to station each month, and then we'll broadcast to the others. Trying to leverage technology. By doing it that way, we're paying less man hours to the medical director's office to go out and teach those classes over and over. Again, hopefully making some smart choices that are going to help us on the budget side of things. Got multiple people in the department that are in paramedic school, some that are working on passing their national registry exam and so forth, but quite a bit going on there. And with the oncoming ambulance transport services, we have to put in place our entire medical director sign-off process and our field training process for our paramedics that are going to be riding on the ambulance. So they are working with Best EMS on that to get all that put in place. Chief Florence has been writing policies and working with Lexipol on the EMS side of things for policy development, and it's just There's a lot going on. There's a ton going on, especially in the EMS world.
Chief, I'm going to go back to the fire operations update. You said the fire and EMS records management system will go live February 1st. Is that kind of the first step to what we've asked for in terms of performance metrics and
Yes.
outcomes on patients and things like that?
Yes.
Is it just our stations, or will our service providers be contributing to that data?
So for the rest of this year, it's going to be our stations, and we get reports from each service department now. Each of our contracted providers are providing data back to us. We're likely going to continue to refine our requests from the departments on what we want as far as turnout times, response times, call breakdowns, and so forth, so that we can get you better data. Many of them are using several different softwares, so that data comes in a lot of different formats, and then we have to spend a lot of staff time tweaking that data to get it into some kind of presentation format that we can bring back to you. I don't have a decision or a solution on what the long-term solution will be, as far as, are we going to ask them to input county calls in our software? They have access to that. How we do that? That's a very onerous thing to put on them, because they're now having to manage responses in 2 sets of software, and that doesn't go without notice for me. I'm not looking to complicate things, but one of the things that the Fitch study highlighted was that our data collection was very poor, and it was sporadic, and so. Again, that's not lost on me either, that we have got to improve our data collection. So we are aware of it and working on it, but exactly what that long-term solution is, I don't have that answer for you just yet.
Okay.
Short term, it'll be our stations.
Okay. Given Chief Mays is gone, I think we ought to vote to make that his problem, so.
Oh, well, in a way it is, because Jeff's working on it, and Jeff reports to Kurt, so it is kind of Kurt's problem. You're not wrong about that.
Okay, at this point, I'm going to take the Tarrant County ESD1 into executive session under section 551.071, consultation with attorney, and 551.072, real property. And we're going into executive session at 7:43 p.m. 6:43 p.m. I was talking Eastern time. Tarrant County ESD 1 back into session at 7:24 PM. I will accept a motion to proceed as deliberated in executive session.
I make a motion to proceed as deliberated in executive session.
I second.
All in favor?
Aye.
I will accept a motion to adjourn.
So moved.
I second.
All in favor?
Aye.
We are adjourned at